My name is Michael Stelling. I studied medicine and physics at the university, and after my medical studies, I went to England. I was lucky enough to complete my PhD in physics under the supervision of Peter Mansfield. Sometime later, Peter Mansfield won the Nobel Prize for the development of magnetic resonance imaging. That, of course, helped me a lot at the beginning of my career. I worked in Switzerland for a while. I then spent a year and a half in basic research at Siemens in Erlangen, Germany, and then became a clinical research fellow at Harvard Medical School in Boston, where I also worked in the field of magnetic resonance imaging. At the same time, CT angiography was entered into clinical practice. So I worked in these areas and did clinical practice. I then returned to Germany and took up a position as a senior physician specializing in magnetic resonance imaging at the Großschadern Hospital. Next, I decided to go into private practice. I first founded a large group private practice in Frankfurt. Over time, I found that I was not completely comfortable working in a large private clinic, so I decided to start a private radiology practice. This clinic, specializing in imaging diagnostics, gave rise to other areas of clinical practice. First, I began developing the Prostate Cancer Center, whose key area of specialization was irreversible electroporation for the sparing treatment of prostate cancer. The work in this direction bore fruit, and we opened a private clinic. The third project that we launched as part of the same clinic is the ANOVA Institute for Regenerative Medicine. I have long been interested in stem cell therapy, which is why I came up with the idea of founding a medical institution of this kind. I have already mentioned that Boris Rubinsky from the University of California, Berkeley invented the method of irreversible electroporation. Boris is my colleague and friend. During our collaboration, we have launched several medical technology startups together. We developed an improved method of irreversible electroporation that expanded the therapeutic options. Interestingly, Intuitive Surgical, a company that manufactures Da Vinci robotic systems used for prostate surgery, immediately purchased this technology. We are also engaged in other projects. We have developed a new method of cryopreservation, which may be helpful for solving the problem of organ transplant surgery. And that is not all, because I am interested in many other things as well. ANOVA is an institute for regenerative medicine. I can't remember exactly how much has happened since the institute was founded. Probably 6 to 8 years have already passed since its foundation and the beginning of our work in the field of regenerative medicine. We are the first clinic and the first institution in Germany to receive official authorization for the production of 2 stem cell-based medicines. The Paul Ehrlich Institute and the regional authorities supervise our work in this area. We can offer treatment with stem cell-based medicines to patients from abroad. We have done everything possible to obtain approval for their production. This requires an enormous effort that many other specialists are not willing to make. There was a time when the process of regulating the introduction of cell products into clinical practice in Germany had not yet been harmonized with European standards, but at the same time here in Frankfurt in the University Hospital Association, there were medical institutions that were engaged in cell therapy, for example dendritic cell treatment. In my opinion, it was senseless that these hospitals decided to stop working with cell therapy because they had not made much effort to obtain official approval. Medicine continues to evolve and cell therapy is certainly an important medical advancement. Stem cells play a special role in this field. The development of stem cell therapy can be roughly divided into several stages. I call the stem cells themselves the first stage of development, the second stage is the stem cell secretome, and the third stage will be certain substances, such as microRNA. From a scientific point of view, everything is very clear. It is absolutely clear what needs to happen next. The problem is that it takes too long to bring a new type of treatment into practical medicine. Our mission is to bring modern treatments to patients as soon as possible, because there are people who simply cannot wait. There is always a range of options for treating a particular disease. There are classical methods which are more or less effective. There are more modern methods of treatment, and work on the development of new drugs continues. And now we have another type of treatment, which is stem cell therapy. In certain areas of medicine, we or other medical institutions have more scientific publications and more experience in the use of stem cells. Our approach to working in this area is exactly what is called translational medicine, which means that we evaluate the data presented in scientific publications and decide whether stem cell therapy can be effective for the patient. Only if there is evidence that a treatment is effective can it be offered to the patient. If there is no such evidence in scientific publications, we will openly tell the patent about it. We recommend stem cell therapy to patients in areas of medicine where we have seen successful results. We offer 2 stem cell-based drugs for which we have received approval. To make it easier for you to understand, the control of our production is similar to that of a small pharmaceutical company. If you want to obtain a license to produce a stem cell-based drug, you must specify how you plan to do it. Every step has to be clearly defined. So before we applied for the license, we had to decide exactly how we were going to produce the drug. And now that we have the license, we cannot change the production process, even though there are hundreds of ways to do it. Even if another company, research institution or clinic elsewhere on the planet uses a similar stem cell-based drug, let's say autologous mesenchymal stem cells, and produces their Secretome, we have clearly established our own production technology because there are allogeneic stem cells, embryonic stem cells, and many more different stem cells. Because we have clearly established our own production technology, institutions can process these stem cells in very different ways, using more or less replication cycles, culturing them on a tablet or in a bioreactor, and using different nutrient media. The final drug will be completely different, which means that there is no way to evaluate it, because only a specific stem cell-based drug is subject to efficacy evaluation. The Secretome is what stem cells can produce. When we started to think about the principle of stem cells, the first idea was this: cells in the human body die, then stem cells are injected into the body and replace the destroyed cells. Then they did experiments on animals. For example, the goal of one experiment was to induce a stroke in a rat. In most cases, female rats with two X chromosomes were used in the experiment and stem cells were harvested from males of the same race with one Y chromosome. The Y chromosome was the marker. Well, the female rats were injected with the stem cells, and although they had a stroke, their well-being improved. The researchers then opened the brains of the female rats to find the injected stem cells from the male rats, but they never found them. Logically, the question arose as to why the condition of the female rats improved in the face of the stroke. In the end, it turned out that stem cells do not actually replace neurons in the brain, but have the ability to identify a specific problem, in this case a problem in the area of stroke development. This happens because of the secondary messengers that the cells use to contact each other, and then the cells themselves start releasing secondary messengers, including microRNAs and cytokines, through this secretome, which is a collective term for the factors produced by the cells. The stem cells can activate the patient's own resident stem cells, resulting in the repair of the affected area. Of course, other events must also take place, such as the formation of new tissues, stimulation of the formation of new blood vessels, etc. All this happens thanks to the stem cell secretome. This is the mechanism of stem cell action. In our clinic, we use the following two options to collect stem cells: from bone marrow or from subcutaneous fat. Mesenchymal stem cells are harvested from subcutaneous adipose tissue. They are found on blood vessels such as pericytes. Minimally invasive procedures are used to collect stem cells from both sources. The necessary biological material is taken from the patient's own body, but the patient must first undergo diagnostic tests. The scope of diagnostic tests is also clearly defined. We have to make sure that the patient does not have any infectious diseases. The presence of an infectious disease is an exclusion criterion because in this case the processing of the collected biological material in our laboratory is prohibited. After the stem cells are collected from the patient, they are sent to a special laboratory and processed. Once the medicine is ready, it can be used. If the stem cells are taken from the bone marrow, the treatment process takes significantly less time and can be performed on the same day. It takes about 2 weeks to produce a stem cell secretome, but in this situation there is an advantage. We can get 10 or 20 doses of secretome. We also have permission to store the secretome for 2 years, so the patient does not have to undergo another stem cell collection procedure for subsequent treatments. We believe that the stem cell secretome is cleared from the body after 4 weeks at the latest. Certain metabolic processes take place as a result of which the secretome is removed from the body. Accordingly, the primary effect of the therapy is relatively short-term, but secondary effects are soon activated. They develop against the background of the influence of the secretome. These secondary effects also last only for a while. In our opinion, the optimal interval between 2 treatments is 4 to 6 weeks. However, the fact is that patients who come from abroad for treatment do not have the opportunity to visit us every 4 weeks. Therefore, we offer an alternative treatment schedule. The patient comes to us every 3 months and the treatment lasts for 5 days. On Monday, Wednesday and Friday, the stem cell-based drugs are administered and the patient goes home, Of course, this is an alternative. Many clinics that specialize in stem cell therapy claim that the patient only needs to visit the clinic once, receive an injection of stem cells, and that's it. This is complete nonsense, because the aging of the body and any disease progresses. With stem cell therapy, the disease continues to follow its own course, while the stem cells drive it in the opposite direction. This is the case with most treatments today. Of course, there are exceptions. For example, a broken bone sustained while skiing will fuse. After some time, the broken bone will heal and a complete recovery will occur. However, most diseases are chronic, which means that it is simply impossible to achieve results with a single course of stem cell therapy. Our clinic excludes the treatment of patients with infectious diseases because there is a ban on processing their biological material in the laboratory. The treatment of patients with aggressive forms of cancer is also excluded. This is our own initiative, because we have not yet been able to prove that stem cells or stem cell secretomes do not contribute to the progression of cancer and do not have a negative impact on the patient's condition. Therefore, the treatment of this group of patients is excluded. Of course, we cannot treat critically ill patients, such as those on mechanical ventilation. It is impossible to collect stem cells from them because it is too dangerous, and in such situations, we cannot do this. In our practice, we have not seen any serious complications associated with stem cell therapy, or any complications at all. Of course, we do perform invasive procedures to obtain stem cells, such as liposuction, which involves the removal of subcutaneous fat. Liposuction is a surgical procedure that is performed thousands of times a day for aesthetic plastic surgery purposes. Therefore, there is a possibility of developing minor side effects, but they do not pose a threat to the patient's health.